Today will be, there we go. My colleague Andrea Howerton is providing technical assistance. She's just begun the recording, so thank you, Andrea. This will be recorded and placed on the Zoom grants link. So folks will be able to access it who might not be able to join us today. It is now 11:03, so let's get started and honor those who are here on time. Okay, again, introductions. My name is Gretchen Bruce. I am the Rural Behavioral Health Program Manager with King County, the Behavioral Health and Recovery Division. There are a few folks in the King County in the meeting today, both Andrea, who will be supporting us in the meeting, and some others who are partners in the general contracting and some of the ARPA funding. Let's, I think we do have a small enough group that we can introduce ourselves or put it in the chat if you are in a meeting or in a place that you can't otherwise introduce yourself. But if folks want to come on the screen, turn off mute and say hello to everyone in the room or in the chat. I'll pause for a moment. I'm seeing Andrea. Andrea, do you want to just say hello to folks?
Sure. Hi, everyone. My name is Andrea Howerton. I work in the Contracts and Procurement Division here at DCHS, helping Gretchen with this RFP. I'll be taking notes and writing down all the questions and answers that happened today. Please feel free to ask questions within the chat as well, and we will get those all recorded.
And Andrea is also the person who is management lead on this particular RFP. So if you have questions, FAQs, and all of that, she will be the one receiving and helping me respond to those and get those posted. So she really is a warm hand in this process.
Yep. Welcome, everyone.
Let's see. Michael, I'm seeing you. I don't know if you want to introduce yourself in person or just simply in chat.
I can say hi. My name is Michael Brown. I'm the Chief Program Officer with Hero House Northwest. Excited to be here.
Okay. Jenny, I see you next.
Hi, good morning. My name is Jenny Johnson, and I'm the Executive Director at Vashon Youth and Family Services in rural unincorporated King County.
Rachel, I see you next.
Hey, everybody. I'm Rachel Dreon. I am work for Behavioral Health and Recovery Division here at King County as the workforce coordinator and ARPA specialist. I'm happy to meet all of you. I'm just kind of sitting in today, learning, and as I'm fairly new to King County, and so happy to be here and learn with you all.
Okay. Rebecca, you are off screen. I don't know if you want to introduce yourself. Here's your opportunity if you do. And someone at TNHS, Evelyn. Bernadette.
Hi, I'm off screen. I'm Bernadette Jacobs. I'm also with Hero House Northwest, and I'm the Director of Digital Communications or Engagement and Communications. And I'm also just taking notes right now, so appreciate it.
Great. Okay. Thanks, everyone, for joining us today. Does anyone particularly that I didn't see and call on want to say hello? Otherwise, we'll be going on to what we will be covering today. Andrea, next slide, please. So our conversation today will be an overview of this particular request for proposal, which is for outreach and engagement in rural communities of King County. We will also be covering the ARPA requirements, which are the requirements layered on by the fund source. This is a federal fund source. We'll be covering what are the community service areas and the rural partner areas where we're seeking to support the partnerships, the programs, and the services. We'll talk about the grant application and capacity building consulting that's available to all partners. We'll talk about the rating criteria and timeline so you can help gear your application towards what it is that we're hoping to see and the sort of application that will be most competitive and the programming that we want to support getting in place in the community. We'll talk about how to use Zoom grants, although I think most people are familiar with it by now. King County has been using it for several years, and have an opportunity for questions and answers from yourselves. Next slide. This RFP builds on some of the lessons that we have learned from our partners in conversation on rural behavioral health concerns, issues, needs, and partnerships that exist and can be leveraged, supported, and made into a stronger system. One, it builds on knowing that there is a need for increased access to services in rural and unincorporated communities for behavioral health services. And that we want to directly respond to the experiences and challenges of rural communities. And some of the themes that they experience is the time that it takes to travel between sites, as well as having flexible time outside of traditional work hours, because people may live in rural King County, but work in a more urban area. And so to access care requires non-traditional hours or time for transportation, as well as transportation spent on public access. The distance, the cost of that, that there can be sometimes less technology access in rural communities, and what can we do to bridge that gap? Stigma of accessing rural health when neighbors tend to know each other, helping to reduce stigma and increase awareness and just simply access to program services. We want to acknowledge that rural communities are in the best position to identify and respond to the needs and build communities of support and capacity. And you'll see that the RFP heavily emphasizes partnerships and system connections between rural partners and providers. We want to increase the awareness about behavioral health and access to services, both that exists in the rural areas, but from time to time, there may be services that people want to access in a more urban area. Maybe they work in an urban area, but how to help them learn how to navigate the system. We want to integrate what we learned from this RFP and other services in rural areas into our overall level of system level planning in King County as it relates to behavioral health, but also general human services. And we do need to and want to recognize that rural communities are not homogeneous, and that the plans and services need to address the diverse needs. Next slide. Oh, sorry, I got slowed up. Okay, the purpose of this procurement, 4 broad themes: increase access to rural residents, expand access and availability of behavioral health care in rural areas, especially as it centers around the community service areas, or what we call CSAs. Mobile services, those kinds of services that find people where they are, meets them in places that are comfortable and convenient to them. This RFP and this fund source can even include the purchase of vehicles, which you can retrofit to become a counseling space to go meet folks. The active outreach and engagement of people, which means not sitting in an office waiting for them to come to you, but going out there and finding them where they may be. Telehealth, including purchase of technology, tablets and hotspots that people might want to or need to procure to engage in telehealth. One of the things that is purpose of the procurement is doing what we can to increase Medicaid enrollment, because that is a sustainable fund source at the back end of this ARPA funding. When it ends, because it does have a hard end date, it's money that was delivered in response to the impact of COVID-19. So the funding does end. And what we want to do is make sure that there are some on-ramp opportunities for people to get into sustainable healthcare, behavioral healthcare, if that is their desire. So one of the things is to be either an agency or a provider who can bill Medicaid, or have partnerships and relationships with someone who can be that conduit to help folks get into Medicaid or be heard longer term services, as that may be a desire or appropriate for the person who's receiving the services. Next slide. Are we up to ARPA requirements? So As I noted, this fund source is what we call the American Rescue Plan Act, ARPA, and it is specifically funding released from the federal government to respond to the impact of COVID-19. Millions upon millions of dollars were provided to King County, and they apportioned those dollars to respond to housing needs, employment needs, just a wide range of needs, and specifically behavioral health, and in this case, specifically behavioral health in rural communities. It is a wonderful opportunity to build some strong system strengthening services and supports that can carry us through both this time of COVID-19 and prepare us for when these dollars end. But I do want to ensure that potential partners understand some of the limitations of the dollars. They must be spent by the end of next year. And that some of the challenges is that it is a reimbursement-based invoicing. You need to demonstrate that costs, the exact costs were incurred delivering these services for which we are contracting, and it requires quite a bit of backup documentation in terms of general ledgers, payroll, timesheets, receipts. I would say that our partners who are currently receiving the funding tell us that they are easily spending 3 to 6 hours a month putting together their invoice packages. And this invoicing is done monthly. So as I said, it requires significant backup documentation. And because the invoices are so intensive, it takes a fair amount of time for us to review them. So the reimbursement can be slightly slower than typical. Instead of 1 or 2 weeks, it can be a month. I just want people to be aware of that when they plan on how the cash flow and the funding might impact their program operations. The opportunities with this, though, are still wonderful. It allows us to build system capacity in rural King County, to provide outreach and engagement that would not otherwise be funded, to bring into services people who might otherwise not be engaged or may not have touched the services for quite a long time, and build an on-ramp to some of the sustainable behavioral health services that exist through BHERD and Medicaid funded services. Next slide. The eligible services and activities, these are detailed with quite a bit more depth in the RFP, but broadly, it funds outreach, engagement, assessment, and determination of eligibility, both for services under this RFP and eligibility for the BHERD and the Medicaid services. We know that it takes time to build trust and relationship, and someone may not want to sign all that Medicaid funding or Medicaid paperwork right away. And we don't want to make them do that just because. We want to build on what their goals are. And during the time that we have this funding and services, we can build short-term individualized service plans that meets them where they are, perhaps meets all of their needs in that short time that we're working with them. And if they need additional longer-term services, work with them to figure out, okay, is the Medicaid system the one that is going to be best suited for you? What can we do to help you with the paperwork and the many layers that it takes to get into that? Or what are some of the other options available to you? Maybe private insurance. Our goal here is to meet people, again, using that phrase, meet them where they are and figure out their best resources and opportunities, and be that person who's working alongside them to help them connect to those. It even includes accompanying individuals to their in-person screenings, helping them figure out telehealth and some of the technology that perhaps till now has stumped them and has been their barrier to accessing services. We find that a lot of folks in rural communities, telehealth has been a silver lining as a lot of things under COVID moved to electronic and virtual access. But for some folks, that was the final straw that disconnected them from services because the technology itself was too cumbersome. We can be that hand-holding support, and could even be, purchasing and providing tablets, hotspots that allows them to access this important opportunity. The next one, we want to make sure that partners are really connecting with local services, providers, community-based organizations So that if you go to a senior center and they say, you know, so-and-so comes in here occasionally, but I really see that they need some additional assistance. Is there a way that you can connect and guide them and engage with them to see what is going on and how we can support them? We can do both, you know, a warm handoff engagement, but we can also just be in the community looking and gaining recognition, gaining, you know, the regularity helps people become familiar. And so just being out there, letting people see your van going by or you there at the coffee shop on a regular basis. So they begin to learn who you are and they come up to you. That, of course, includes being visible to the residents. It also includes being visible to the local partners. And there will be an expectation that funded partners to this opportunity also engage in some of the existing monthly or quarterly collaborative efforts that are already in place, and sharing your knowledge and learning from the other partners who are in attendance. Next slide. As I've noted, the services here are dedicated to the community service areas. King County is one of the, if not the largest county in the nation. I think it's, you know, we're even slightly larger than the state of Rhode Island. In that we have a lot of opportunities and services in some of the urban areas, but the rural areas can be very far-flung with challenges of transportation, access, and all that comes with it. King County has a stated goal, though, to make sure that we are supporting all of our residents. And for that purpose, we have some specific dedicated community service areas with the local service offices who make sure that we have, as I've a presence and that we are paying attention to the rural areas. Those are Bear Creek. Excuse me, I'm losing my train of thought, but and I actually can't see my slide well enough to read those the 7 areas. One thing that I want to say is that the West Seattle area for this RFP is not going to be one of the CSAs, but the other 6, as you can see, the pink, the purple, the green, the yellow, and Vashon, those are the eligible areas here, and we're trying to reach the residents. Acknowledging that a resident of one of these areas may want to access services in an urban area is fine, but the residents that we enroll should be coming from the CSA areas. Within the RFP, we're asking you to identify which CSA area you intend to be active with your service provision. And there was 1 point for each CSA that folks identify in their application. Next slide. The desired outcomes from this RFP, both in terms of the individuals who access the services and the system that we're hoping to strengthen, is on the part of the individuals, improved knowledge and awareness of behavioral health services and resources that are available to them, reduced stigma so that they feel comfortable and know that everyone can benefit from behavioral health services, and increased access and utilization of our behavioral health services. Again, as I mentioned, our BHERD funded and Medicaid funded system services. In the long run and at a system level, we are looking to improve the policies, systems, connections, and supports in our provider partners and the flow between and within partnerships. So broadly, those have the desired outcomes both on a personal level, at a provider level, and at a system level. Next slide. The organizational eligibility criteria is that either a current KCICN contracted provider, that's King County Integrated Care Network. The definition for that is provided in the RFP. Or a direct partner to a KCICN provider. I will acknowledge that I'm somewhat new to this field of work. And so when I wrote KCICN as the language in the RFP, it's because I assumed that meant Medicaid, able to bill Medicaid. I have since learned that you can be one without the other. You can bill Medicaid and not be a KCICN contracted provider with King County. So we will be amending the language of the RFP to indicate that either you are a current behavioral health provider with the ability to bill Medicaid, or have a strong partner with someone who could be that on-ramp for the individuals who you might see through your contracted supports if you become a partner to this RFP. The next criteria is that you need to have demonstrated knowledge and experience in providing outreach and engagement to individuals with behavioral health conditions, and the knowledge of how to help those folks enroll in behavioral health services. And then a demonstrated commitment to equity and social justice and reaching some of the most marginalized communities most impacted by institutional and systemic racism, knowing that if we open the doors widest to the folks that face the most barriers, we are improving our systems for everyone, but especially want to reach those who have been experiencing the greatest barriers to provide them with the services that help them make use or achieve their human potential, which is one of King County's guiding true north values, helping individuals and communities achieve their full potential. Next slide. Prioritization. This is slightly different from eligibility, but as we receive applications and as we are evaluating them, this will be the prioritization that the review panel uses. The first thing, that they are a provider with expert knowledge of behavioral health services and the ability to get people enrolled in Be Heard and Medicaid funded services. That applications clearly articulate an existing and strong connection to the local rural communities, knowing that especially within rural communities, partnerships and reputation and relationships really are the bedrock of how people get best served. And that organizations that articulate that they are working to build a system connection and become strong partners within that community. The available funding is 1.1 million. The highest that we will fund any particular application is 400,000. We anticipate that there may be some funded less than this, because if we are seeking to support 6 CSAs, obviously 6 times 400 is 2.4 million. So what we'll be looking for is a demonstrated budget that explains what you're proposing to do and the costs are realistic with the expansiveness of the budget. We are asking that folks include 2 budget scenarios, one which is your maximum ask and one which is your minimum, so that we can understand how you yourselves would calibrate services and funding and be most responsive to local levels of need. And that your applications must identify which ones and at least one of them of the 6 community service areas that you are focusing on rural areas, as we have identified them as the CSAs. Next slide. There is technical assistance to applicants. The first phase is if you would like to receive grant application consulting. It is available at no cost. I show the web link here. King County, you could Google King County DCHS grant application assistance, or if you're watching this video, the link there will show you the actual web address. This is available at no cost. It helps you determine if the services that you are proposing fit within the RFP and guidance on how to answer questions. And support for reviewing it. The next phase, if you are selected for funding, there continues to be capacity building consulting free to your organization that helps you build capacity and strengthen your agency, your programs. It is, as I've noted, free, can help people review their fiscal systems, HR policies, board development, ESJ plans, a wide variety of things of what your organization might identify as the areas of growth that you would want to pursue. It's available through consultants who are specialized in those areas. Information on how to access that would come at the time during when you are under contract, and we'd help you make those connections. The rating criteria. You can see here is broken down into the headers. We are asking you to identify your service location, and that is something that we will specifically rate and award points to, because we want to make sure that we are seeking to serve all of King County, or as much of King County as we can, and points will help us to make that selection. Your organizational description, which is how does your organization approach behavioral health, and what is your organization's capacity around the issue of behavioral health? But then the project description, how will you specifically address this issue of outreach and engagement, mobile activities in rural CSAs? Which best practices might you use in this project? Which activities will you propose? Again, I've emphasized that collaboration and partnerships will be an important element, and it actually gets points in this to make sure and help us ask questions and discern what partnership activities you would propose and be involved in. Equity and social justice is an important component, making sure that we are reaching some of the most marginalized and those who face the most barriers, as well as what is your own organization doing to promote and understand ESJ? How do your services listen to the feedback of participants, and when and how have they changed program models based on what participants say, this is what we need to be most responsive to our needs? Workforce development, if you're on this call, I'm sure that you are familiar with the fact that there is a hiring crisis in nonprofit services and behavioral health services. We're asking folks, what can we do to support you to hire, retain, and adequately pay wage equity and keep your staff engaged in the work? We're not asking that you have all the answers, just mostly that you are at this point exploring those very same questions and figuring out your own organization's approach towards it. We ourselves are figuring out our approach to it. So there's no right answer to what you answer here, but just the fact that you're attending to the issue. Budget and fiscal is goes without saying, we're looking for what would be cost-effective proposals, but I also want to stress that we will not be going for the least expensive or anything like that. It's more, are the costs commensurate with what you're proposing to provide? And data collection, as we all know, learning from data, learning from the results, outcomes, and participant activities helps us to continuously improve. We'll want to hear what you have done within your organization to manage, collect, analyze, and use data as part of your own program improvements. Next slide. Submission is in Zoom Grants. I think most folks are familiar with using it, but the application consulting assistance can also help you figure that out. Andrea can help you figure that out. We do have the proposals due at 2 p.m. on March 9th instead of 5 p.m. because it has occurred that people have hit a technical snag at the very last minute. So we want to make sure that that doesn't happen for you. And especially on the last day, know that a lot of organizations in Zoom Grants tends to slow Zoom Grants down. So you are advised not to do that. Wait until the last moment. Complete submittals will include a response to the summary questions, the narrative questions, and the budget. The budget is something that you download from Zoom Grants, complete, and upload again. Narrative questions are completed in Zoom Grants, but I do find that most people find it easiest to download the Word document, write their answers, and then copy and paste it into Zoom Grants. Know that there are character limitations to both Zoom Grants, but also to guide you to be concise and succinct. One of the things that I like to tell applicants is you don't need to tell us why we should fund the issue or why this is a needed service in your community. We actually already believe that. Know that. That's why we are releasing the funding. So you don't need to convince us why we need to fund the service, but you do need to help us understand how your services are responsive to that and what you will specifically be doing in response. So the greatest clarity is your best bet rather than expansive, beautiful writing and prose. Next slide, the timeline. Today is our applicants conference, February 14th. Happy Valentine's Day, everyone. The final day to request technical assistance is February 27th. That's in order to give the consultants time to learn about you, review your ideas and your thoughts, and give you timely feedback so that you can complete your application in time by March 9th. The final day to ask questions, if you are reviewing the RFP or you're listening to this and there's still some niggling questions for you, to reach out to Andrea through DCHS contracts@kingcounty.gov. That will show up later in a slide. But the final day to ask questions is March 2nd, so that we can post them as an FAQ so that all people, applicants, can benefit from it. The last day that we will post an FAQ in terms of if there's any changes or making sure that you are receiving the most up-to-date information will be March 5th. Applications are due March 9th. The review panel will be reviewing and meeting through the period of March. Notification of awards will be on around April 10th, with a goal to begin contracting and negotiations, even services, by May 1st. Final slide.
Gretchen, we missed one slide right before this, talking more about Zoom grants.
Very good.
Just making sure that you check Zoom grants regularly, especially in the library tab. That's where we upload any FAQ or amendments to the RFP. And another thing that Gretchen was talking about regarding Zoom grants, if you do write your answers in a Word, like say a Word document, and then transfer it over, Zoom grants does not like formatting. So just make sure that you delete all of your formatting, that's bullets or anything like that, before you copy and paste. And if you're experiencing any issues, please contact me as soon as you can. You can either contact me through the contact admin tab in Zoom grants, or this DCHS contracts@kingcounty.gov email, and I'll help you. I can usually help with most troubleshooting in Zoom grants, or we can get the Zoom grants help desk involved. So I just want to make sure that we went over that piece, because Zoom grants does get finicky about that stuff.
Great. Thank you for catching that, Andrea. Back to the final slide. Questions? Does anyone have any questions? Do you want to come off mute, or do you want to put them into chat? Andrea, do you have any other insights into accessing the grant application assistance?
Not insights. I believe the list of providers is an attachment to the RFP, so you can choose whoever you like. There's little bios there that you can read for each third-party provider and choose who you would like to use. There's more resources on our website, which I can bring back up here. And they really are there to assist you in determining whether your application is a good fit for this RFP, to help you with writing assistance, help you with Zoom grants, technical assistance. They can contact us with questions. Yeah, they're really there to help you, and it's all free to you. So please utilize them as you need. Jenny has a question.
Hi, hi there. Thank you. I was just wondering if you could provide a little bit more detail on what the funds can and can't be used for, a little more granular.
Well, it's both broad and narrow in that rural mobile outreach and engagement. And so it really is, how do we find and engage folks who are likely to be Medicaid eligible, but that phrase is likely, and the purpose for that likely is so that if and as they need sustainable services, there's an opportunity for them to stay engaged in a way that meets their needs. There are some, income limitations to that, but that's not the prevailing criteria by which you should connect with someone. We are looking for folks who have been not engaged or disengaged in behavioral health services, disengaged as previously receiving services. Lots of S words there, but haven't connected with them in the last 3 months. In terms of ARPA funding, the ARPA funding limitations can be more technical rather than allowable for services. They don't allow for food and refreshments. They don't allow for, or if you're going to charge program costs such as rent or the counseling spaces, we have to go through an elaborate analysis of the square footage of your space that's dedicated to this service. That can be overcome through, technical response or technical analysis. But really it's about finding people in rural areas who would benefit from behavioral health, are not currently engaged in behavioral health, and helping them figure out what would serve their needs. Again, it's about finding people where they are, not waiting for them to come into your offices. But then if the service provision is best provided in your office when they choose to do that, that could be one of the transition points. But the first point of finding people should be in places where they normally are as part of their day-to-day routine, not ours. Did that provide the clarity you need, Jenny?
I think so. Yeah, of course, really practical questions like, so mileage, staff time, that kind of thing, as I'm putting this into play.
Yes, again, the tracking for mileage will be detailed. The staff time will be detailed, but it does allow for all of that, both in terms of the outreach person and someone who might eventually be the person to whom they're handed off if the outreach and engagement person is not appropriate for, is not a clinician with licensed abilities to provide that counseling. Any other hands raised by other folks? Okay. Well, this will be posted to Zoom grants. We will also, from time to time, do amendments. As I've noted here, I need to provide clarity and that you don't have to be a KCICN provider, just simply have an ability to connect folks to Medicaid if that's the participant's goal. Other FAQ that might come up will be posted to the Zoom grants. And I'm looking to Andrea if she can think of any other final closeouts that are typically helpful. Otherwise, we appreciate you attending and we'll look forward to reviewing applications.
Yeah, I'll try to get this slide deck and recording and any Q&A that comes up, either the one that Jenny just asked and anything else, up on Zoom grants by February 22nd. So look for those.
Okay. Thank you for joining us. I look forward to partnering with the communities. This ends our bidders conference.